Diagnosis of hypertension. Diagnosis of hypertension. It is commonly based on clinic blood pressure measurements. Diagnosis of hypertension should be made on repeated clinic visits unless the blood pressure is substantially elevated, that is, greater than or equal to 180 by 110 millimeters mercury, and or there is evidence of hypertension-mediated organ damage. The grading of hypertension is as follows. Out of clinic blood pressure measurements, home blood pressure measurements, and or ambulatory blood pressure measurements can be used as an alternative strategy to repeat clinic blood pressure measurements when available. Home blood pressure measurements and ambulatory blood pressure measurements are more reproducible than clinic measurements and more closely associated with home-mediated organ damage and the risk of cardiovascular events. The definitions of hypertension according to clinic, home, and ambulatory blood pressure measurements are depicted in this chart. Recommendations on repeating blood pressure measurements. If the blood pressure is less than 120 by 80 millimeters mercury, blood pressures must be repeated at least every 5 years. 120 to 129 by 80 to 84 millimeters mercury, repeat at least every 3 years. 130 to 139 by 85 to 89 millimeters mercury, repeat blood pressure at least annually. Consider out-of-clinic blood pressure measurements to exclude masked hypertension. 140 to 159 by 90 to 99 millimeters mercury, repeat office blood pressure measurements or out-of-clinic blood pressure measurements to confirm the diagnosis of hypertension. 160 to 179 by 100 to 109 millimeters mercury, confirm within few days or weeks. Greater than or equal to 180 by 110 millimeters mercury, confirm diagnosis if there is evidence of hypertension-mediated organ damage. Repeat measurements within 1 to 2 days if there is no evidence of hypertension-mediated organ damage to confirm diagnosis. Clinical assessment of hypertension. History. Patients with known hypertension. Patients with known hypertension, we must look at the onset of hypertension and duration, previous blood pressure values, history of hypertension during pregnancy or while on oral contraceptive pill, antihypertensive medication, tolerance and side effects of antihypertensive, example, postural hypotension, erectile dysfunction, ankle swelling, adherence to treatment, and if poor adherence, find reason, example, forgetfulness, polypharmacy, or due to side effects. Risk factors for hypertension. In the history, you must find out if there is high salt intake, sedentary lifestyle or high BMI, smoking and alcohol, psychological aspects such as depression, diabetes mellitus or impaired fasting glucose, dyslipidemia, previous history of ischemic heart disease, stroke or transient ischemic attacks, family history of hypertension, and premature cardiovascular disease. Screen for causes of secondary hypertension. In the history, a history of flash pulmonary edema, renal artery stenosis, sweating, palpitation and headache, that is pheochromocytoma, weight loss despite good appetite, palpitation, neck swelling, that is thyrotoxicosis, muscle weakness, tetany, cramps, arrhythmia, primary aldosteronism, snoring or excessive daytime sleepiness, obstructive sleep apnea, drugs such as NSAIDs, OCPs, antidepressants, steroids, cyclosporines, recreational drug use such as cocaine and amphetamines, and over the counter medicines. A separate slide with cardiovascular risk assessments is available later on in this presentation. Complications related to hypertension and hypertension mediated organ damage. In the history, you must elicit chest pain, shortness of breath, palpitations, claudication, peripheral edema, headaches, blurred vision, nocturia, hematuria, dizziness. Cardiovascular risk assessment. More than 50% of hypertensive patients have additional cardiovascular risk factors. Presence of additional cardiovascular disease risk factors increases major adverse cardiovascular events. ACS, stroke, PVD, and renal disease. Screening and management of modifiable cardiovascular disease risk factors is important in managing hypertensive patients. Can use specific course to calculate 10-year cardiovascular risk factors. Hypertension mediated organ damage. It is defined as the structural or functional alteration of the arterial vasculature and or the organs it supplies that is caused by elevated blood pressure. It may cause left ventricular dysfunction and ischemic heart disease, transient ischemic attacks, strokes, intracranial hemorrhage, dementia, albuminuria, CKD, peripheral vascular disease, hypertensive retinopathy. The methods of diagnosis and identification are given below. Clinical assessment of hypertension. Examination. General examination. Height, weight, and body mass index must be assessed. Cafe au lait spots. Waist circumference, neck circumference, thyroid enlargement, signs of Cushing's disease, features of acromegaly, peripheral pitting edema, suggestive of heart failure. Cardiovascular examination. Pulse rate, rhythm, and character, cardiac apex, shifted or not, and the character, additional heart sounds and murmurs, radiofemoral delay, suggestive of coarctation of aorta. Funduscopy. Stages of hypertension in the funduscopy are depicted below. Other systems. The other systems to be examined are abdomen, purple striae suggestive of Cushing's syndrome, palatable or enlarged kidneys, renal bruise, renal artery stenosis, respiratory system, bibasal crackles to see evidence of pulmonary edema. Clinical assessment of hypertension. Investigations. Basic investigations. Basic investigations should be performed in all patients with hypertension. Full blood count, particularly hemoglobin, fasting blood sugar or HbA1c, lipid profile, creatinine with estimated glomerular filtration rate, AST, ALT, and serum electrolytes. Investigations for screening for hypertension mediated organ damage. 12 lead ECG, 2D echo, brain CT or MRI, ankle brachial index, creatinine and urine creatinine ratio or urine protein creatinine ratio. The suggestive findings are depicted in this slide. Investigations for screening for secondary hypertension. TSH or free T4, serum metanephrine, 2D echo to identify coarctation of aorta, ultrasound scan abdomen, renal parenchymal disease, duplex renal artery stenosis, plethysmography if suspected obstructive sleep apnea. Thank you.